What if I told you that there's a way you can not only teach your learners new skills they're likely to see again in the future, but there's also a way to equip learners with the capacity to successfully approach new problems they've never even seen before? Hi, I'm Amy Gardner, Associate Dean for Faculty Development and Director of the Academy of Medical Educators here at the University of Colorado School of Medicine. Come along with me and learn how Dr. Juan Lessing, Associate Professor within our Division of Hospital Medicine, helps facilitate adaptive expertise among his learners.
When you're teaching a learner a new skill, it's not too difficult to promote digestion and recall of that new skill when everything feels familiar or routine. But medicine is often far more complex than that, isn't it? What happens when a patient's symptoms, presentation, or situation doesn't follow the textbook or is unfamiliar? The challenge then is to equip our learners with skills to solve the novel problems they might face in the future. In the literature, we call this adaptive expertise and describe it as the ability to transfer existing knowledge or skills to create solutions for an unfamiliar or a new problem. But how in the world can we equip our learners with skills to face the wide range of unfamiliar problems they might encounter in the future? Hi, I'm Dr. Juan Lessing, and I am an Associate Professor of Medicine and Clinician Educator here at the University of Colorado School of Medicine. Want to help your learners think critically, adapt, and problem solve in real-world scenarios? Here are 4 strategies to promote adaptive expertise. First, build deep, or what we call conceptual understanding. Encourage learners to think out loud when solving problems. This has the added benefit of helping you assess their reasoning. Encourage understanding rather than memorizing. Ask how and why questions to strengthen connections between new and existing knowledge. And whenever possible, relate new concepts to real patients for memorable and deep learning. Second, use meaningful variation. Expose learners to different patient presentations of similar conditions to help them recognize key patterns and variation. Ask what-if questions to explore how diagnosis and treatment might change based on factors like setting, symptoms, or comorbidities. Simulation-based learning is also a great way to apply knowledge in dynamic, real-world-like scenarios. Third, create a safe space for challenges. Let learners struggle productively by using guided discovery. Have them generate solutions before giving answers or corrections. This builds both problem-solving skills as well as, very importantly, comfort with and confidence in handling uncertainty. Finally, support self-regulated learning. Encourage lifelong learning habits with evidence-based strategies like spaced repetition, goal setting, and deliberate practice. And adopt a coaching mindset. Ask non-judgmental, open-ended questions to help learners self-assess and reflect on their growth. And remind yourself and them that we are all on this journey together. So there you have it, 4 strategies for facilitating development of adaptive expertise. Build deep understanding, use meaningful variation, create a safe space for challenges, and support self-regulated learning. I encourage you to try them out and see how your learners do, whatever the future may bring.